There comes a point when the question changes. At first, a family might ask, "Can mom still manage at home?" Then it becomes, "What would make staying at home safer and easier?" Maybe it's after a hospital stay. Maybe someone is recovering from an illness or surgery. Or perhaps everyday activities have gradually become harder. And suddenly, the family isn't just looking for help. They're looking for the right kind of help, from people they can trust, in a place that feels familiar. Welcome to Review Remedy by ScoreDoc, where we turn healthcare research into practical information you can actually use. Today, we're looking at 3 best home healthcare services in Austin, Texas in 2026. But instead of simply counting down 3 names, we're going to tackle the questions families should ask before choosing home-based care, because the best provider on paper isn't necessarily the best fit for every household.
And there's one distinction we should make right away. Home health care isn't necessarily the same thing as non-medical home care. Depending on a person's needs and eligibility, home health services can involve skilled clinical care delivered at home. Other home care services may focus more on assistance with daily activities, companionship, personal care, meals, or helping someone remain independent. So before comparing providers, start with a very basic question. What does this person actually need help with? If you can answer that clearly, the rest of the search becomes much easier.
Let's begin with Capital Home Health. For families researching home-based healthcare in Austin, this is one of the providers featured on ScoreDoc's 2026 list. But here's the useful part. Don't start the conversation with, "How much does home care cost?" Start with, "What services can you provide for someone with these specific needs?" Describe the situation as clearly as possible. Is the person recovering after hospitalization? Do they need help managing a health condition? Are they having difficulty moving around? Do they need skilled nursing or another type of professional support? The more specific you are, the easier it becomes to determine whether the provider is appropriate for your situation.
Next is CenterWell Home Health. When families are evaluating a home health provider, one factor that's easy to underestimate is communication. Who updates the family when something changes? Who do you contact with questions? How often is the care plan reassessed? And what happens if the patient's needs increase or decrease? These aren't just administrative details. When care is happening inside someone's home, good communication between the patient, family, caregivers, and healthcare professionals can make the entire experience much smoother. So put communication near the top of your checklist.
Our third featured provider is FirstLight Home Care of Austin. For families exploring home-based assistance, this is another name worth researching. And here's a question that can reveal a lot. What happens if our needs change? Maybe your loved one initially needs only a little assistance, then they have surgery, or their mobility changes, or they need additional support with everyday activities. You don't want to discover after signing up that the provider isn't equipped to meet the next stage of care. Ask about flexibility, scheduling, and how changes in care needs are handled.
Now, let's make this practical. If you're comparing these 3 providers or any other home care services in Austin, use this 6-question checklist. 1. What type of care do we need? Medical or skilled care? Personal assistance? Companionship? A combination? 2. How many hours of support are necessary? A few visits per week is very different from needing assistance every day. 3. Who will actually provide the care? Ask about qualifications, screening, training, and supervision. 4. How does communication work? Know exactly who the family should contact when something changes. 5. What happens if the regular caregiver or clinician is unavailable? Ask about backup coverage. 6. What will we actually pay? Don't assume every service is covered the same way. Confirm eligibility, insurance coverage, co-pays, and out-of-pocket expenses directly with the provider and your insurer when applicable.
There's another question that deserves more attention. What does the person receiving care want? If your parent, spouse, or loved one can participate in the decision, include them. Maybe they don't want someone coming every day. Maybe privacy is extremely important to them. Maybe they'd feel more comfortable with support at certain times of the day. Home-based care should ideally help someone maintain as much independence and dignity as possible. It's their home, after all.
And before care begins, take a look around the house. You don't need to redesign the entire place. Just identify obvious hazards, loose rugs, poor lighting, cluttered walkways, bathroom challenges, stairs that are difficult to navigate. Sometimes a few simple changes can make the home environment considerably safer. And if the person has recently returned from a hospital stay, ask their healthcare team what limitations or precautions need to be followed.
One final tip for families. Keep a shared care document. It can be as simple as a note on your phone. Include medications, allergies, important phone numbers, upcoming appointments, care instructions, and questions for the healthcare team. If several family members are involved, everyone can stay on the same page. That can be especially helpful when one person can't be there for every appointment or visit.
And remember, home-based care isn't about choosing the provider with the most familiar name. It's about finding a service that matches the person's actual needs, schedule, location, and care goals. Use ScoreDoc's list as a starting point. Then ask questions, compare answers, and make sure you understand exactly what you're agreeing to before care begins.
If you're researching home health care in Austin, we've included the complete ScoreDoc guide in today's show notes so you can explore the 3 featured services and continue your research. Because the goal isn't simply to find someone who can come to the house, it's to find the right support to help someone live safely and comfortably at home. Thank you for joining us for another episode of Review Remedy. Until next time, ask the right questions, involve the person receiving care, and remember that good care starts with the right fit.